I wanted to welcome Dr. Wanda Boone, who has been collaborating with us for several years now in terms of symposia and workshops, and she's been very active in the community efforts here with her Together for Resilient Youth Try, and she's going to tell us today about her work in the community and actually getting things done.
Thank you. Good morning, everyone. I'm so glad to be here. It's a pleasure to be among folks at Duke. I actually started working at Duke in 1974, doing research on babies that were born with metabolic disorders. So I have a history with Duke and research. So as you can see, we're founded in 2003, and we use the public health model in order to address the challenges that we have as a community. So we use the public health model to address the underlying challenges, again, that we see in our community. And we're talking about then things like substance use, chronic disease, and violence. And it seems so expansive for so many people. And it is difficult because those are subjects that are connected, but we really don't realize how. And so when people ask what we do, it's almost like we do everything. Well, how can you do everything? Well, it's not exactly everything. So the circle that you see in the middle describes Tri Coalition. We are a coalition, and as such, we address several things from the perspectives of individual stakeholders. So we have youth, ages 9 through 17, college Tri, you don't have to be in college, but 18 to 24, and then of course, adults in the community. The Good Neighbor Business Network, we have about 650 businesses that partner with us in Durham. Those are in Durham, and then we have others across the state. And I'll talk about why we need them in a little while. Faith communities, law enforcement, community members, health, schools, parents, and then sadly parents that have lost children due to overdose or some other sad situations. And so when you think about the individuals, the stakeholders that are involved, as we can imagine, we need all of the stakeholders' lived experience and their particular perspective, because I'm a grandma now, really with older grandchildren even. But my point is that if I tried to talk to youth about what I remember or what I know or what I feel is what's happening now and today, they would laugh me to scorn. But because we call on them to let us know what's really going on throughout all of these years, then we're able to stay current with the lingo, with the things that they're experiencing. And that's been most important. And the same with the other stakeholders. Law enforcement sees things a different way than community members do. And when we bring them into the fold, so to speak, we want to make sure that they understand what collective impact means and what true collaboration means. And if they can't get it, and we train them and we talk to them, then we think, well, maybe there's a better place for you to collaborate, because this is based on community input, and we put the community at the center. So, and believe, and we work by. If you want to experience communities authentically, question history, embrace the unfamiliar, and challenge explanations of reality, because whose reality are we going to follow and or believe? We're all different in this space here together. Our common agenda is to hear this presentation. You're hearing it a different way than I'm saying it or that I'm even experiencing in this room. And so how can I, since we're talking about Tri, how can I be a member of the community that's accepted? Because I'm not exactly like the community that I serve. That's the other reason why we have stakeholders, because sometimes people don't want to see me. Okay, I've become okay with that. So I've let go many, many years ago of this is my program. I want to see it done this way, and my way is the right way, and there is no other way. And so that's what I mean. And so when we come forward with humility and expecting to hear something different and new, then we can be successful in collective impact. So just to see my journey in these years and why perspective matters. So I grew up in Teaneck, New Jersey, obviously a long time ago because the picture is the picture. And so that's me on the left with my best friend, Christine Koner, and we're still friends today. Then in the middle, that's me as a teenager. And so I'll show you in a minute why this becomes important. And then that's me now. Let me see how I look on the screen. Well, anyway, that's me now. And so when I was a teenager, I was asked to go around with other teenagers in New Jersey to talk about the Newark riots. I lived in Teaneck. I had no experience with riots, and not even many Black African Americans. There were only 3 families in Teaneck that were Black African American. But I wrote this compelling reason why I should be nominated to go around New Jersey and talk about police brutality and the Newark riots. And it was true. It was my heart as a 15-year-old. And even though I've been a part of corporate America and working at Duke, it's still my heart today. So here I am back in the space that I was in so many, many, many years ago. And so this is one of the accomplishments of Teaneck. Some will see it as an accomplishment. Some would see it as Teaneck sold out because we want segregated schools. We want the fact that Black children could go to Black schools and have the experience. My grandparents lived in South Carolina and it was segregated, but there was a pride about having businesses that were owned by Black African Americans, high schools that were entirely Black, teachers and students. And so it's a matter of perspective again. And so let's look at some things that we already know so you can see how we do our work. Right-hand side, I hope it's right, yeah, right-hand side, you see some census tracts. And those are the census tracts that are most impacted by the negative social determinants of health. I think we already know that, but since we already know that and the fact that these should be the areas where we focus our attention, the question is, why isn't that happening? Why aren't we looking at the census tracts that have the most need in all of the social determinants of health and saying, okay, I'm going to take census tract 1001 and I'm going to work there, understanding how many people live there, the demographics, the schools, the challenges. To me, that's the smartest way to build consensus and also to solve the problems that we have. Then, of course, we need individuals outside of those census tracts that have the grants, that have the information, that have the research, that have all of these kinds of things that can help promote this trust and collaborative action within these communities. So our coalition is not a Black coalition. We're very diverse economically, and well, not me, but there's some people on our coalition that are millionaires. That would not be me. And they have connections outside of Tri-Coalition that we draw upon in order to solve some of these problems that exist. And in the social determinants of health, unfortunately, sadly, racism and discrimination are a part of every single part of the social determinants of health, whether we're talking about economic stability, neighborhood and physical environment, education, food, community safety, and health care systems. And so we have to talk about racism and discrimination, even though it's difficult. But when we understand that there's a disparity and then more disparity and challenges in certain census tracts, then we have to come to grips with that being the case. And so again, individuals in the community trust me because we literally worked in these communities and in public housing for, well, actually since 1974. So we have a generational relationship with people that live in public housing. We didn't live in public housing, but because they're there for generations. And so, you know, people that are my age and their families know us because of relationship. So in collective impact, we have a common agenda. So if we're talking about gun violence, then all of the stakeholders in our coalition focus on the common agenda of gun violence. Or if it's substance use, the perspectives of everyone, we need to include that. And so that's common agenda. Most important to me is shared measurement. What does the data say? Because we can look at one set of data that says that one thing is being seen, but we have to dig deeper in order to find out what really is going on. So, for example, Durham is the only county in North Carolina that has more overdoses among Black people than any other county in North Carolina. And so I started seeing this in 2018, 17 or 18. And I am co-chair of the Durham Joins Together Task Force with Wendy Jacobs, County Commissioner. And so every month I'd look at this data and say, and over 60%. So I looked at the data and I rang the bell, rang the bell, rang the bell. To, sadly, no avail, to be honest. And so I asked the North Carolina Injury Prevention Branch to do some digging into the data to help me find out what was going on. And so what it is that Black and brown, well, Black people are taking prescription drugs with alcohol. And that's the reason for the overdose. So then that says to me, okay, what do we have to do? We have to talk about what's happening in terms of taking medications properly, and some of it may not be prescription drugs, but opioids with alcohol. So what do we need to do? What is a message that will resonate with the community that's affected? I mean, this makes sense, right? So addressing that with young people and alcohol use, college students, adults, senior citizens, because then we look at who is overdosing and what age they are. Okay. So then mutually reinforcing activity, because providing information is okay, but it's not going to change policy. So we have 7 strategies for community change, where the lowest thing to do is to provide information, and then the highest thing to do is to change or implement policy. And so that's what we've done. Okay. And then continuous communication. Whew. And because we're talking a lot of things, and some people, and it's okay, are not interested in what's happening with children. Their most focus is on adults or senior citizens. And we don't say, okay, you have to work with children, but who are you? What is your passion? And how do you want to interact with what we're doing? So this is a very busy slide, and it's meant to be so you will stay awake for the next few minutes. So what this says is that we center community and we co-design activities. 7 strategies for community change are something that SAMHSA recognizes and supports and says this is the way you change things. And so that's why we use that evidence-based process. But we don't tell community, we're coming in here to do an evidence-based process. It's called 7 Strategies for Community Change. But we talk about that, why this change helps, why that change helps, why we need to look at alcohol outlets in order to help solve not only overuse of alcohol or risky behaviors in alcohol, but also in order to say to them, we know that you care as much about the community as we do. Help us keep our community safe. Then you deal with those 650 businesses that are selling to minors, that are selling to adults that are intoxicated. And then you partner with the state in order not to get them in trouble, but to provide some other corrective action and updated training, which they need and have to do according to the state laws. So we come in with that as a way to help them get things done and a way to help the community. So we need community stakeholders, researchers as advocates, people who are involved in policy to help put forward those policy changes like the Good Neighbor Business Network, because it's recognized statewide now. And then we need the involvement of larger groups who impact change, like Durham CAN or the Durham Committee on the Affairs of Black People or the NAACP, so that it's not Wanda Boone, it's not just Wanda Boone coming to legislators and anybody else and saying, hi, we would like your help, because that does not work, sadly. But and so then we create a system that empowers community members who don't necessarily have a voice to learn how to be the voice and to be out in front. And so sometimes I'm interviewed by TV like I was last night, but my hope is to be more in the background and make sure that people are put forward, as our young people did last night when we talked about gun violence. So when we ask about what our coalition is like, there are 108 people that answered this question, who are champions of change. That's what we call people who work with us in the coalition. And this is what they said about themselves. And so you can kind of see or sense the heart, passion, and impact of people who know how to work in this way. All right. So this is our roadmap for building a resilient community. This is the foundation. This is the North Star. This is why we do this. This is how we want our community to look. And you'll probably recognize that this is a roadmap for trauma-informed care that's used with businesses, and hospitals now are recognizing that their success lies in the trauma-informed care model. But I looked at it and said, wait a minute. This is a process that not only benefits businesses, it benefits coalitions, people that are working on this, and it also benefits individuals. So within a family, within a community, within a business, within an organization, there must be safety, trust, empowerment, collaboration, support, and acknowledgement and respect for history and culture. And so that's the core value. And then after that, we need to look at broad strategies. And you'll see that this is from the North Carolina Health and Resilient Communities Theory of Change. So that's where it comes from, and we are using it. Change mindsets, change power. So uplifting community voices and helping to make sure that community is involved with their voices and experiences. And so that's why when we do focus groups for researchers, we make sure that they understand that if TRI is participating and engaging community members, there has to be respect and understanding and the ability to be humble and listen to the voices of the people that they're getting data from for their projects, right? And sometimes that's met with discomfort because people are accustomed to working in spaces where they are comfortable. And it may be my job is to do this for my research or paper or whatever it is, and that's their focus. There's nothing wrong with that focus. It's how they get the money. That's the focus that they have to have. But if you want people to communicate with you in an authentic way, it's not even bringing pizza. It's more about, do you hear me? Back to my space as a person who is having a difficult time, with all things that are considered to be normal and achievable. And so that's the quote unquote secret sauce that some would say. And then what are the results of relationships, program components, policies, resources. Population results, acknowledging those historically left out. Prioritize those historically oppressed, particularly for those historically disadvantaged. So it's no longer and shouldn't have ever been top down. It should have been equal communication and literally really working together. We can do that because we know that we can have compassion, and if we've left compassion far behind because of whatever situation, we can get it back and we can work from that place. And so the outcome or the impact is healthy and resilient communities for all children and families. So while we work with and find strategies to uplift those who are in vulnerable communities, we do that for everyone. So as I said, our coalition is diverse. All right, so how many of you know about adverse childhood experiences? Because if you do, I'm not gonna go through this. So there are 4 of them and good. We'll save a little bit of time. And you know the outcomes. The 11th ACE that has been added is racism. And I don't think many people know that, but if you do, yay, I'm so happy. And these are the outcomes which you are familiar with. Oh, it won't let me go forward without saying this, that when you look at this and think about what TRI wants to achieve in terms of preventing obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, broken bones, and lack of exercise, smoking, alcoholism, drug use, missed work, then we understand that where we really need to focus is on adverse childhood experiences, trauma, and the outcome of that. So while we're talking to individuals that are in vulnerable communities or even living in public housing, and wow, that is another conversation, very difficult, then we can go there. For resilience, this on the left is the most wonderful thing that is on the Duke website in terms of checking where one stands in terms of all of these environments and situations. and you can click on one, and then it spits out your percent of how difficult your life is and what you need to change. It's like I took ACEs in 2014. You know, and now since 2014, when I look at, where is it, physical activity and fitness or nutrition and lifestyle, I'm like, you know, this is not working for me. And so it's a wonderful tool. And then it leads to what you need to do in order to change that based on what Duke has to offer. I wish there was something, and oh, see, when I have a wish, here it comes. What's available in the community also that would benefit. On the side, of course, these are also some of the things that one can do to increase their resilience. So the title of this was the stream. Whew, that was close. The stream, and this is why. Holding young people solely responsible for underage drinking, or you can fill in the blank, for being in a gang, for having a weapon, for not doing well at school, anything is like holding fish responsible for dying in a polluted stream. What's the stream like in Durham? What does this stream look like? And who is working with and on the stream to support young people so that they're protected and we create an environment where they can thrive? So when our children were growing up, we had little plugs to put in the electrical sockets and, you know, things to hold the cabinets together so that they would be safe. So if they crawled over to something dangerous, they wouldn't get hurt by it. Simple in my mind. And if we didn't have those protections in our home, then they could have been hurt. Poison control. I mean, that's, you know, one of the things. And so when we think about the stream, those are the kinds of things we need to think about. What is it in our stream in Durham, North Carolina, or wherever, that impacts young people so they are not protected? The adolescent brain doesn't fully develop until someone is 25 years old. So when our children graduate from high school and we think, they say, I'm grown now, and we say, you're grown now, and then I need some money. I need to come home. I can't live on my own. It's like, but I thought you were grown. I was through with you. And so that's the reason also why we work with college freshmen and sophomores, because they're just minutes from where they were in high school. And so we kind of think, okay, they're off to college. That's a whole nother presentation about what happens during the first year, especially during college. That is not a pleasant story. Young people are suffering there as well. So we had, what time are we over? Because, I'm sorry, it's 10:29. So, oh, good. All right, so we have a resolution that is at the city, the county, the Board of Education about our strategic action plan and that there is a crisis among Black youth in Durham. Again, think about the stream that's Durham. And we each can do something about it, because I talked about the 7 strategies of community change, the coalition folks. And so we're working with a lot of people. I said 108 have signed up to be a part of this in ways that they want to contribute. So we don't have a lot of meetings. This is what we're working on with youth. This is what we're working on with parents. This is what we're working on with policy. Where do you fit and what do you want to do about it? Some people only want to provide information. That's fine. We don't force anyone to be in a place where they don't feel passionate. Let's look at some data. From the Youth Risk Behavior Survey published This is the last one published. So the publication came out in 2021, it says. It came out in 2023. So it's on the healthydurham.org website. I'm going to share some things here, but if you have a chance, please read it. So if we're talking about the stream at school, right? Now, law enforcement can't do everything, teachers can't do everything, so you see why we have stakeholder groups. All right. So out of those individuals that took the survey, 40% of Black or African American students said that they had seen gang activity at their school such that it was evident to them that this was going on, all right? So that doesn't mean there's a problem with other children, because you see that Hispanic, white, male and female students reported the same thing. So what would your question be? What's being done about gang violence in the school? And is that really where we should focus? And then when children began associating with or joined a gang, all right? So do we wait until they're 12? No. We see that some kind of intervention, some kind of life-changing something, having a different mindset has to start much earlier. I would say 8 or 9. And so again, this is how we figure out where we should be. There are programs that want to start at 14, but then that's more of an intervention at that point than it is a prevention activity. This is the biggest deal. So I've been looking at youth data since 2007 and comparing what's happening. This is the first time that I have ever seen suicidal ideation to this extent among Black African American children. Never have I seen it. So we say, oh, that's probably because of COVID, but it was there before, and mostly among white and Hispanic children, and the numbers of Black children were down. So, you know, I'm thinking, okay, so we see the data. Who's doing what about suicide prevention that is working with the students and not necessarily having a program to say, I got it, I found this, you know, I found this program on CDC's website and this is what we need to do. Did you ask the children if that would work for them? And so, but we use information from CDC, SAMHSA, and national resources because they're reliable, right? We don't have to come up with our own things. But if we don't ask those that are authentically involved, then that's where we get in trouble. So our youth coalition actually gets a tip every month that's on a specific topic. So next April is Alcohol Awareness Month. So they get the tip, citation CDC, and we talk about it, and then we ask them to make this their own. How would you translate this message into what you're experiencing, what you are feeling, and how you would speak to a peer and your parent about this? They write music, poetry, artwork, dance, all under the underlying message of alcohol prevention. So they have to tell their parents about this message first, because young people don't want to listen to their parents, but they want to educate their parents. And we give the parents a heads up. Don't talk to your child yet, but this is the topic for the month. And we say, okay, you have to prove to us that you shared this message with your parent. So they make videos with their parents of their conversation, or they text back and forth about their conversation. And parents say, I didn't know this. I didn't know what was happening on social media. I didn't know what was happening with Jewel. I didn't know about the things that are going on in school. Okay, so then you create a bond, or are creating a bond, that may not look like it because young people are not gonna, do anything that the parents hear it. The young people, when they interview them separately, they say, my mother didn't know anything about marijuana. Yes, like, yes, she does, but she's not just. And they're so proud of the fact that they're teaching their parent or caretaker something that they know, but the parent doesn't know. And so it's within that atmosphere that we work with young people. And then they have to share the message with 3 to 5 other people their age. We have schools that are a part of this as well. So if they're not the individual, then an adult at the school takes the tip and does the same kind of thing. And so when we see this, we don't go to the county and say, what are you going to do about these suicide rates? Yes.
Sorry to interrupt.
No.
I'm clear on this graph. So is that
We're surveyed.
that we're surveyed?
Yeah. Yeah. Considered, made a plan, attempted. So it's a crisis, isn't it? So I consider it a crisis. And so that's why we have the resolution. And we have said that we are involving professionals who have agreed to volunteer their time using the S-BERT model to help and assist young people who go beyond what we can provide. So we have these prevention methods, and our work on prevention of trauma does a certain amount that helps young people and families. But if they need more help, can't afford to get it, then we have a group of professionals who said that they would help. So again, it's not that we negate what the health department does or any institution does, but for us, we can't wait that long. We cannot wait that long until another young person commits suicide or uses a gun to kill someone. There are things that we can do as a community working with institutions in order to get this done. And then bullying, there's bullying, and research says, of course, that bullying leads to this and leads to this and leads to that and leads to the other thing. And so, yes, we need to address bullying because it's not a small thing. I asked our granddaughter about bullying at school, and I also asked her about suicide, and I asked her about, has anyone ever treated you differently because of the color of your skin? Now, I didn't expect the answer, and it wasn't, I didn't say, okay, here's a question I'm gonna ask you, make sure you answer it this way because I'm gonna use it in a, happens. But anyway, and so at first she said, no, nobody has ever said anything to me about the color of my skin. And I didn't coach her any further than that. And she said, wait a minute, isn't this Black History Month, February? I said, yes. And she said, well, these 2 boys came into my classroom and we were having a discussion about Black History Month, and they started making monkey sounds. They started laughing at us. They started saying bad things about us. And so eventually it came out. So think about what that is for someone who doesn't have the opportunity to say that. And so that's why I'm saying that that's an issue. She also told us, and other young people last night on our call, you'll see a slide, if I can keep my mouth shut and keep going on with the slides, that says that almost 10% of children in high school say that they can get a loaded gun in less than 10 minutes. And so the stream, right? So what do we say? Lock up your, parents, lock up your guns. And one child said, there are woods next to our school, and we think that people are storing their guns in the woods or in their lockers or in their car. And she said, well, you know those metal detectors that old people use when they go to the beach? She said, why doesn't somebody just go see what happens? But I mean, you know, maybe that wouldn't happen, but that's an idea. So I'm not going out there. Okay. And so mental health, self-esteem, and I'm just going to go through these, especially since it's going to be on the video, because I want to get to some resolutions. Okay. So to address violence, what does this stream look like? What is it really like in Durham? So in Durham, according to, you know, published information, North Carolina Injury Prevention Branch, intimate partner violence. And who may see that happening? It might be the children at home. It might be the children in the community. Other people are affected other than the victims, right? So when we see something like this and we see, you know, all the other ones, it's like, what? You know, so let's look at what's happening in the stream. And that doesn't mean, okay, so I have this is saying we've helped people with intimate partner violence, but I have a program. Programs are great. I want to keep saying that because we really do believe it. So I have a program that addresses intimate partner violence. Was the family involved? Were there children that witnessed this? It doesn't go that. It's helping the victim, which we really need, but who's there to heal the family? Because that's what the stream is for. And we have community health workers and other programs that assist with that. Okay, here we go. Committed by gang members versus crimes that are committed by non-gang members. And you see that most of the crimes that are being committed are non-gang members. So that if we want to deal with violence, then it is a global issue that impacts and involves all children. So the campaign needs to be all #all kids, right? And so we can't separate the ethnicity of young people because there are gang members that wear khakis and it's not Izod, that's old, but whoever, you know, polo shirts. Man, I can't get it. Children come help. Who walk around like that, you wouldn't know that they're a gang member or that they are white and a gang member or that they're white and supplying the drugs or that they're white that party with Black people when their parents don't know that and they're getting drunk and high and everything else. And so it has to be all kids. And so I, of course, mentioned that to some people. This is from the gang report that was done in 2021 or 2022. So it's out there. Substances and what's being used by gang members, but also used by other children. We have this, you know, concern about legalization of marijuana. I mean, marijuana is very bad for young people, you know, under the age of 21 because of the adolescent brain. Colorado really did a lot of research on it. And what the governor of Colorado said is that we are unable to enjoy, he didn't say enjoy, the benefits of recreational marijuana in terms of money because they have to deal with the schizophrenia and bipolar disease that they have connected to people who use lots of marijuana in their state. So for me, just like we have controls with alcohol outlets, we need to do the same thing for marijuana, if that is going to be the case. But until it's the case, of course, it's illegal. But children are buying gummies over the internet. And they're using gummies, they're cooking with stuff, baking things. And so that's why I'm saying we have to go beyond, look at the stream and deal with it there. One of the things that I said during a high school presentation, the whole school, 600 students, and so, well, what about marijuana? There's marijuana. My parents and grandparents use marijuana. And the point is that marijuana today is not the same marijuana that one used or might have used in the 70s. And so I said, well, what kind of marijuana do you use? Instead of getting upset, did you hear what I said? I said, marijuana is not good. Okay, so what kind of marijuana do you use and how often? Oh, I have gummies. So when you get a package of cookies, and it talks about the ingredients and how many a serving size is. What's the serving size on a package of 12 cookies? It says 2. I said, what does it say on the marijuana gummy? 1. I said, oh, and so how many do you use? Well, sometimes, you see what I mean? And children are being taken to the emergency department in Durham, North Carolina, because they pass out, they become sick because they're using these products at school. And so I said, so now do you see what the issue may be? And I said, these are the warning signs for you to think about. And then, you can talk to your mother and grandmother about what they're doing. But this is a serious issue. Okay. So, you can't see this very well. But the difference here, when we look at social media, gang-involved young people say that they're influenced 47.5% by social media, music and social media. It's out there, it's on YouTube, it's on their phones or whatever. So they hear it at school. So if we think that our children are safe because we only listen to Bono at home, they're getting it at school. So you have to change the mindset and concern of children. And law enforcement says, 29.5% that children are impacted by social media and music. So that's why I'm saying we take the stakeholder that's involved because they're not getting it, right? We're showing what young people are saying, especially quote unquote gang members, but it's everybody. And then looking at the differences in where social media lands with those individuals. So this is what I was saying about the Good Neighbor Business Network. So I wrote an article regulating outlets that sell alcohol in predominantly African-American and Hispanic neighborhoods, which they mostly are, by the way. And the outcomes show that crime goes down when alcohol outlets are regulated. But we chose the process of saying, we're partnering with you. We believe that you care about our community as much as we do. They don't pay any money. We don't pay them any money. They get a full page ad or posting that says that these are our good neighbor businesses. And we get data from law enforcement that shows whether they pass or fail a test. If they are not in compliance, then we don't say, we're taking you off the list. We don't, unless they remove them. Egregious, and they need some more training because turnover is ridiculous, then we will train them free of charge. That's something that they want. And the North Carolina State ABC knows that this is a Good Neighbor Business Network. Was this a new employee that didn't look at the license? So that's what we're talking about. We're not talking about people that just do egregious things like storing guns in the convenience store or selling stolen goods in convenience stores, which they do. Okay. And so, and then they provide information from us on prevention. So you see the gentleman holding up one of our brochures, and then community members can come in and pick them up, and they call us and say, we need more or something like that. So that's how they are a part of the process. Okay. So on the left-hand side are our core programs. Champion of Change is the coalition where anybody can become involved. We don't charge people to be in the coalition. I think I need to rethink some of these programs. But anyway, and so then we have Coping Together, which is a family program that was brought over from Kenya, specifically in Durham. Dr. Eve Puffer is the individual. Oh, I love this so much. So this is the third year that we've done Coping Together, and 95, if not more, % of the families that participate say that their family interaction and communication and sense of belonging and has increased. So, and now she has a paper out. So our community health workers are the facilitators of the program. And so Coping Together is open for everybody, and again, there's no charge for it. And so they're the facilitators. One of the things I ask of researchers when it can happen is that the people that work on the paper be listed as co-authors. And so that has happened with Eve's article. And so I'm at the end, which is end of the list, which is fine with me, but it is so rewarding to see that people, that individuals are being rewarded for the work that they've done. So excited about it. And then Change Your Words, Change Your World. Dr. John Evans, anybody know about him at Duke? Okay, so he authored The Process of Writing for Health. It's different than journaling. So his research showed that sleep is enhanced, the immune system is stronger, all these fantastic things. Mind, mind-body is more of an understanding. 6 classes, 1 hour each. And so he passed away last January, but before he did, he gave us all of the materials, made Nicole, hey Nicole, made Nicole and I, she's online, sorry, made Nicole and I master trainers, so we are able to train other people in that process. Wow. And so we're still doing that. Living in Future Tense is our youth coalition. Trauma Informed, our work with ACEs, and then Resilient Together. We have a social group. It's not therapy for families that have lost loved ones due to whatever the situation is. And then on the other side, we have the health program, which are individuals who live in public housing, who we train and we provide certificates for them to train other people in their stakeholder community. It's so necessary because who needs to hear about ACEs and resilience? Who needs to hear about opioids? Who needs to hear about suicide? Who needs to hear about gun violence? The people that don't get a chance to speak on it. Research included, they learn how to learn how to tie research to the information that they're given. It's in their literacy level. And it has been examined by NCCU. And so, that was close. And so they're able to do that. And it's just wonderful because they're out there. They've actually given Narcan, naloxone spray, to people who have overdosed in the community. They said they were afraid to do it, but if they had a chance to save a life, that's what they wanted to do. Wow, okay. So they learn about adverse experiences in self-care, opioids, overdose, and naloxone, substance use violence, the power of Ubuntu, which means coming together as one, and how all of these things impact the youth, the family, and the community. And so because we want to make sure we're doing things according to the science that's out there, then we make sure that we're tied into these things. And again, lastly, this is our strategic action plan. And I hope that you see how it's all tied together. We need your help too. So in order to make sure that the stream is such that all of us can live a healthy life here in the Durham that we call home. Every child needs at least one adult who is irrationally crazy about him or her. Oh, yeah. And then Ubuntu. I'll close with this story. All right, so there was an archaeologist that was leaving the village that he was in for a while. Leaving at that time. And so there were a bunch of children that were sitting next to him, and he puts a basket of fruit way down there by a tree. And he said, whoever gets to the basket first gets all of the fruit in the basket for themselves. And so when the children, he said, so when I say 1, 2, 3, then get up and run to the basket. So he said, 1, 2, 3. The children stood up, held hands, ran to the basket together, sat down and ate the fruit together. So he said, why in the world would you do that when one of you could have had all the fruit? And I'm not gonna cry. Do you know how many times I've done this presentation? Stood up, looked at him and said, how could one of us be happy and the rest of us be sad? I know, whew, okay. So that's what's meant about the stream. We are all a part of the stream, regardless of who we are or what we've done, have or have not accomplished. You are great and powerful. You're doing wonderful things, and you can assist the stream. And I appreciate it so much to be here. Thank you. Are there any questions?
Are there any questions online?
Not yet.
Not yet.
Yes.
When you were talking about this, well, like being told the message and the information and sharing it with
Yeah. So the way that we look at that kind of data from that process is how would your risky perception of risky behaviors. So how would your parent accept or not accept your use of XYZ? And the answer pre and the answer post. And I think the last time I looked, we had about 300 responses to that. Before COVID, we gave that survey to all driver's ed classes. And then young people have to do videos with their parent or some kind of, thing like that. But I would love to explore how to do that more effectively. So mostly we have the numbers of individuals or groups and their responses to those kind of things. But I think a more rigorous study would be fantastic. And I would be open to it, yes. Yes.
I was thinking Durham, there must be other urban areas. Ideas, learning from each other.
Thank you for that question. So we provide TA around the state in other states and also Kenya, Australia, and the UK. So that's one thing. And just yesterday, I was asked to speak at Bob Doplett's international community on how to engage youth in a trauma-informed process. So sadly, it appears that there aren't very many people who are working with vulnerable communities or just are stuck there, you know? There's a challenge in terms of how do I engage people from vulnerable communities, and how do I conform what's required by a grant process to include this. And so I'm sure there are, but there's so many that are funded in the millions of dollars who don't have that perspective. So STRIVE, which is a program from the CDC, actually has a lot of information about how to do this. And it's on our website. We hand it out to people, so we're not trying to be the only one. And so there are tips and other guidelines for that as well.
So that we take care of the crises and the emergencies and the acts of violence and the victims, but how can we health sort of thing, and and just be reactive but be proactive?
Yeah. The slide about at what age do young people either become members of a gang or are affiliated with a gang member, and that age was 9, 8 or 9. So getting people to realize that prevention has to start early, and it's not just say no. It's creating a different culture around parenting, not saying that parents are doing a bad job, but people can only do what they have the information to do with. So much has changed in our society in terms of how we connect to each other until that's where it needs to start. So Coping Together, for example, or other programs that bring the whole family into the challenges even that are in the family. Communicating what's wrong. Parents go to their rooms, close the door, make sure they're on social media, and then leave them alone. In some families, there's not communication except for, did you do your homework? Did you wash the dishes? And, so that connection has to be there. And then the community has to support that. And so it's a culture shift, it's a knowledge shift, and it's a creating a stream that works. So we're in elementary, middle, and high schools, and we're working with them and that kind of thing. But it's not the school's job either. So. Okay, thank you. Thank you for taking the time. Bye, everybody on social media.